Good morning, everyone. This is Dr. Kusuma from Suria Cosmetic Surgery, and sometimes called Suria Plastic Surgery from my former days. I want to correlate a conversation I had with a patient recently and discuss some clarifications that brought on this consultation because there was some confusion from a previous consult the patient had. So the story goes like this: a patient was interested in some, contouring. Contouring could be the neck, could be, the abdomen. It doesn't matter. In this particular case, let's just talk about the neck, okay? Because generally I'm focusing more and more on face and neck, as all of you know. So this patient heard about something called air sculpting, AIR, air sculpting. And she was told that it is incision free, or scalpel free rather, that it was very little downtime, that it could be done under local anesthesia, and is not that uncomfortable. And it sounded great. I mean, who wouldn't want that? But then upon further probing, she, I guess, reached out to get another opinion through the office. And so I met with the patient and I kind of probed it and discussed a few things. So when somebody talks about local anesthesia, right? A lot of procedures can be done under local anesthesia. I myself do eyelid surgery under local anesthesia. I do some types of breast surgery under local anesthesia. I do full facelifts under local anesthesia. I do some small areas of liposuction or lipocontouring under local anesthesia. I do reconstructive stuff for injuries and stuff like that on the face, or sometimes cancer repairs under local anesthesia. So even brain surgery sometimes can be done under local anesthesia. So rhinoplasty I do under local anesthesia in some cases. So local anesthesia is nothing unique, again, that is special for a branded name that a lot of times people use in marketing, right? Local anesthesia is about identifying the right patient who can tolerate local anesthesia, identifying the right procedure for the right length of time that can be done safely and comfortably for the patient under local anesthesia, having the setup in an office that is no different than a regular operating room that facilitates performance of this local anesthesia procedure as if it's a full anesthesia, meaning having all the equipment and no shortcuts and things like that, ensuring that the delivery of the local anesthesia, which essentially means that putting in the numbing medicine where you're working, local means localizing it to the area of the work. So if it's the neck, localizing the area with numbing medicine, which is put into the skin that numbs the pain so you can do what you need to do. If it's the nose, you put it into the nose locally and not elsewhere in the body. So you don't do systemic application of anesthesia. But even in the local anesthesia cases, by and large, for the most part, we always give some oral medication with some pills to take so they're relaxed. They have some degree of anxiety reduction, maybe some pain reduction. And in addition, we use something called nitrous oxide with oxygen gas that they inhale through the self-regulated. They just inhale it. That causes them to relax. It's called laughing gas. And then when they are kind of in a nice mood, awake, talking, we numb up the area locally in the area that we're working and we deliver it. So again, a branded name that uses this is suspicious to me always. So that's a myth busted. So local anesthesia is nothing needs to be branded. It's something that's used. I use it for rhinoplasty. I use it for facelifts. I use it for some breast surgery. I use it for some lipocontouring, depending on patient selection, health of the patient, having the right team, the right equipment, the right room, and all the rest of it. So you don't take any shortcuts at all, because at the end of the day, there's the result that counts, right? So that's local anesthesia. So nothing needs to be branded about that. Let's talk about this. Clever marketing, right? If you say no scalp used, no scalpel, the insinuation or the meaning of that is that there's no cuts, as if magically fat is removed, and that's how you dupe a patient. It's wrong advertising. You have to make an entry into the skin with some instrument. It may not be a scalpel, which usually is associated with an incision. It could be some other device or some other tool, but an opening has to be made in the skin regardless. So saying no scalpel is really misleading, inappropriate marketing. And that's what the patient thought, essentially. But they're essentially using a different tool that's a rounded tool that still opens the skin so that a cannula, which is the instrument that's put into the skin, can go underneath the skin. So if you make a scalpel incision, you make with a scalpel, you make a linear incision. With a punch tool, you make a circular cut, basically, so that the cannula can go through there, which is a silly way to market, and it's disingenuous. This should be called out because it's not appropriate for patients to be misled like this. So that's the incision. Pain. Let's talk about the pain. Pain is very, very subjective. After practicing for 17 years, I can tell you that every person's pain tolerance is different. I've had patients who had facelift surgery and went to a party 2 days later with like incognito, with glasses and a hoodie and a scarf and stuff like that because they had to go. I've had patients have a scotch the night of surgery with their spouse. Although I don't recommend it, they have. And so pain is very subjective, and I've had other patients who have a suffering rag on their forehead for 2 weeks because they just need more support, right? So I just want to make sure that you understand that pain tolerance is very subjective. Some people have no pain but a lot of anxiety, which leads to amplifying the pain that they feel, which is not a lot to begin with. So pain is really managed well with managing anxiety, with being calm, with being very collected with your thoughts, having a confident physician and a team next to you that can take care of you and make sure that you're okay, so that you have the confidence that reduces anxiety, that you numb or localize and put anesthetic the proper way so that you don't feel the pain, right? So pain is something that's a technique. It's a psychology and medications that are all managed together. So to say a procedure is painless is not genuine. It's the management and delivery of the localized site that has to be well done that reduces the pain. So again, to busticate or to kind of clarify pain is that it's nothing to do with a branded procedure per se. Okay, recovery is subjective again, right? It depends on how well you numb it up, how comfortable the patient feels, how technically the operation is done, meaning how precisely, how well, how atraumatically it's done, how nicely and precisely it's done, and how post-operative management and instructions are provided, and what type of medication is given to control their discomfort. That's what leads to a good recovery. How many areas were done, how big an area was done, what part of the body was it done on, because some areas are more uncomfortable than others. Some areas need more work than others. Some areas are more stubborn than others, right? So all of those play a role in how much discomfort one has, so the recovery can be manageable or very, very easy. Because like I said, I've had patients who have done breast augmentation on, go to the pool and hang out the next day with a bathing suit on. I've had, like I said, facelift patients, go to a party 2 days later. Very, very uncommon, but it happens. So the recovery process really depends on those factors. How big an area was done, how many areas were done, what part of the body it was done in, how well the surgery was done. That's what leads to a good recovery. And most importantly, was the right operation done? So those are the things that go along with the recovery process. Devices. Well, in this particular case, there's many types of devices. In this case, since we're talking about lipocontouring, you have a traditional liposuction where you use human labor to kind of move the cannula to remove the fat with a suction machine. There's ultrasound you can use. There's something called tickle lipo that you could do. There's all kinds of things that cause the cannula to move back and forth with power, so you don't have to push so hard. There's laser that's used. So many things are used, but at the end of the day, all of those devices assist the surgeon to either decrease the human effort or help break up the tissues with some energy source, power of some type, ultrasound or whatever, electricity or something like that, to allow the surgeon to take it out atraumatically, so you don't have to push and kind of cause trauma so hard or whatever, and cause some contraction of some tissues, etc. So devices are utilized for different purposes. And so, but the concept is the same. Do it atraumatically, do it properly at the right depth, take out the right amount, don't overdo it. Do it with some care, some caress, some neatness, minimize blood loss, all of the, and do it with good pain management. So a device assists in all of those things. Again, no need for branding for this. The surgeon should automatically do it. And expectations are to be set. If you lead somebody down a rosy path with marketing buzzwords and catchphrases that paint a picture, that is inappropriate in my opinion, because expectations have to be honest, they have to be clear, they have to be precise, they have to be understood and acknowledged. And that's when you have a very good trusting relationship that leads to very, very good, satisfied, long-term happy patients. And so I wanted to make this because of this confusion that the patient has, that it's pain-free or relatively pain-free, short downtime, no scalpel, local anesthesia, all these buzzwords to get patients in. But then when you really, go to like peeling an onion, go into the depth of it and ask, second, third, fourth order questions, then you can understand the process a lot better. And this should be applied to everything in surgery, really. So hopefully that clarifies it. Don't get caught up in marketing buzzwords and trademark names and stuff. Really sit and talk to the surgeon. Understand the process. Make sure it makes sense to you. Make sure there's a logic behind it. Make sure that you ask not just a simple question, but second, third order questions, so you clarify all of those things. Okay? Thank you so much. Hope that helps.